Good afternoon. I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. This press conference is broadcasting on County TV Channel 20 and the county's YouTube page. The meeting is being interpreted in American Sign Language by Kim Rich, and Carlos Saraceda is interpreting the meeting in Spanish. His interpretation will be available on the county's website and YouTube page shortly after we conclude the press conference. The past week has been a remarkable roller coaster of events. A week ago, we frankly did not see a way forward to meet the new state criteria required to reopen businesses in our county. The County of Santa Barbara was also facing a more than $50 million budget deficit over the next calendar year because of COVID-19 response costs and lost local government revenues. What a difference a week makes. On Monday, Governor Newsom announced that Santa Barbara County would now be eligible to move forward and reopen many more businesses that had been closed by the governor's stay-at-home order, including retail stores and dine-in restaurants. Governor Newsom listened to our arguments and ultimately agreed with the board's unanimous view the unique circumstances posed by the Lompoc prison virus outbreak should be viewed separately from the county's overall public health readiness. This, along with the other suggested revisions to the state's public health readiness criteria requested by the Board of Supervisors and the Department of Public Health, agreed to by the California Department of Public Health, will enable our county to move more very quickly through the governor's second phase business reopening process. Yesterday, the Board of Supervisors unanimously voted to send our attestation documents to Governor Newsom. I signed the letter during the board meeting and we sent it to the governor immediately. We expect to hear good news back from Governor Newsom's team as soon as today or tomorrow. The county has also developed a new website portal to assist businesses to prepare safely open their doors and greet customers as soon as possible. Industry-specific local public health guidance developed through our own county's collaborative RISE guide is available now on the county's readysbc.org website. That's readysbc.org. I've been on the site myself and the information is very user-friendly. Later this week, this website will also host a self-certification portal that will make it very easy for businesses to understand and verify the necessary public health precautions are in place to protect employees and customers. You will know a business has passed the self-certification process by a prominent sign in the window. Another important event occurred this past week when Governor Newsom announced his revised California state budget. Governor Newsom's new revised budget contains nearly $45 million in federal funding to Santa Barbara County to offset COVID-19 costs. Originally, Federal CARES Act funding was only directly allocated to cities and counties with more than 500,000 population. Our county did not receive any of these federal dollars. To address this inequity, the Board of Supervisors and our county CEO, Mona Miyasato, led a successful statewide lobbying effort to convince Governor Newsom to help us financially. Ultimately, 52 of California's 58 counties signed a letter we drafted requesting Governor Newsom allocate some of the state CARES Act funding to counties like ours that had not received direct federal funding. Congressman Carbajal, State Senator Jackson, and Assembly Members Lamone and Cunningham all wrote letters to Governor Newsom to support our county's position. We are very pleased Governor Newsom recognized the inequity of the original allocation of funds and the serious financial needs of our county and all the cities in Santa Barbara County. His new state budget allocates more than $1.3 billion in federal CARES Act funding to partially offset the significant costs cities and counties have incurred to respond to the COVID-19 pandemic. This funding is still subject to the legislative budget process, but with the continued support of our state legislators, we are very hopeful that this much-needed new funding will help prevent deep local government service cuts to our communities. This is all very good news and shows that determination, collaboration, and persistence can pay big dividends. I'm very proud of the determined work by my colleagues on the Board of Supervisors, the other local elected officials from all across the county, our county staff, local state legislators, and members of the public have been doing to position us to succeed with Governor Newsom. Our combined determination and persistence has won the day. As we move forward together into this new phase of the struggle against the coronavirus, it's important to celebrate and recognize how much we can achieve when we work together. Today, I'd like to recognize Cottage Health for providing medical care for patients experiencing homelessness during the COVID-19 crisis. Cottage recently hired a new community nurse to help people before they have a health emergency, with the goal of keeping individuals healthier and less likely to require hospital visits. Cottage's population health initiative serves some of Santa Barbara's most vulnerable community members who are living on the streets and who can end up in the emergency room needing care. With the new strain on emergency rooms from the COVID-19 pandemic, keeping patients healthy and out of the hospital is more important than ever. New technological tools recently implemented at local homeless shelters to slow the spread of the virus have also created new opportunities for client health care visits. Telehealth virtual visits are now an important new tool to easily connect homeless clients and help manage their chronic conditions. These virtual appointments can decrease the unnecessary emergency room visits that overburden hospitals, which is especially valuable during the COVID-19 pandemic. Thank you to everyone at Cottage Health for their tireless efforts to improve our community health through a commitment to excellence, integrity, and compassion. I'd now like to introduce Dr. Henning Ansorg, our county's public health officer.
Thank you, Supervisor Hart. Good afternoon, everyone. We are reporting only 3 new community cases and no prison cases for COVID-19 today. This brings us to a total of 1,520 cases in Santa Barbara County. We currently have 28 patients hospitalized, with 10 of them in the intensive care unit. Of our 550 community cases, about 80%, or 443, have fully recovered. We are very excited that the Board of Supervisors yesterday supported our attestation letter to the state to be allowed a regional timing and sequence of openings in Santa Barbara County. We expect this attestation to get approved by the state very shortly. Once approved, we will immediately issue a new health officer order to give guidance on which businesses can open, providing they have the mandatory modifications for safe operations in place. Businesses must wait until the amended health order is issued in order to reopen. The Public Health Department is proactively working on this order to ensure we are prepared to make this happen quickly once we have the state's approval. The Public Health Department continues to receive inquiries from business owners about what measures they will have to meet to qualify for reopening. We have a dedicated team inside our environmental health division that is helping and giving direction to these specific questions. We will give their phone number and email out shortly. Memorial Day weekend is coming up, and we would like to remind everyone to follow the governor's executive order to limit travel to essential travel only. We are reminding our community again that hotels are only open for essential business and not for leisure travel. We remain in a still critical phase of our reopening journey. All of us are looking forward to a more open city and county, and to be able to enjoy sitting on the patio of a restaurant or a coffee shop again, but we are not quite there yet. Please continue to practice safe social distancing and wear face coverings indoors where needed in order to keep everybody safe. Be assured that the Public Health Department will monitor our case numbers and hospitalizations very closely every day in order to determine if our reopening is causing any increase in numbers. Also, please continue to take advantage of our no-cost testing sites in Santa Maria, Lompoc, and Santa Barbara. The test can give the individual peace of mind, and it does give the Public Health Department a better understanding of the true prevalence of the viral infection in our area. You can go online to lhi.care/COVID testing or call 1-888-634-1123 to make an appointment. This testing option is available to everyone. I thank you for your attention and cooperation.
Thank you, Dr. Azorg. Next, we'll hear from Santa Barbara County Fire Chief Mark Hartwig. Chief Hartwig will tell us about the special precautions that the County Fire Department is taking to protect us from wildfires during the pandemic. Thank you, Chief, for being here.
Thank you, Chair Hart. To those that call this beautiful county home, we are no strangers, or disaster is no stranger to those that live here and call it home. Many of you have had experience directly on evacuation orders and warnings. In fact, some of you have actually been sheltered at a Red Cross shelter after a debris flow or during a wildfire or other emergency. Even as the county takes steps to open up over the coming weeks and months, COVID-19 continues to be a risk. And you must be ready during this pandemic, even during another emergency. I'd just like to spend a little bit of time today talking about preparedness for other emergencies. You should know that various agencies, the counties, cities, districts, including our Office of Emergency Management, is working with our federal and state partners, along with the Red Cross, to implement proactive strategies in the event of evacuation or sheltering within the county in the event of another emergency. Our highest priority remains public safety. And during COVID-19, we will remain vigilant. Evacuation and sheltering in the environment provides, as you can imagine, some new challenges. Challenges that will require adaptability and flexibility to traits that this county has come to be known by from all of us here in the county and the agencies within the county. The fire department, like many others, have adapted our large incident operations in the face of COVID-19. Long gone, or at least in the future here during this pandemic, we won't have these large incident bases. We won't gather for incident briefings likely in a large a room like we normally do, and many of you have seen. We will receive our meals differently and our orders and communicate differently on the fire line. In fact, might even spend more time out on the fire line overnight as opposed to coming back and spending the night in a base camp. Operational and logistical modifications will be made at shelters in accordance with the CDC, our local health officer, California Department of Public Health, to ensure that we have best practices in our shelters, our guests and our workers are protected, and we reduce the transmission of COVID-19. Some modifications to shelter operations might include temperature checks or wellness stations, screening inside the shelter, increased cleaning and sanitation, distribution of individual meals, maybe not in a buffet type arrangement, but maybe just boxed or sack lunches. Cots would be faced further apart, and face coverings would likely be required. Various types of facilities and settings will change, just like you're changing your habits, and things will change as we start opening up the county. We have a web page, many of you are familiar with it, dedicated to preparedness, evacuation, and sheltering. It's, as Chair Hart said, www.readysbc.org. You can also get information on the fire website, www.sbcfire.com. And we encourage all of you, all of the residents in the county, to learn how to safely prepare, to learn about evacuation, read up on Ready, Set, Go as we prepare for this season. I've learned here that fire season starts a little bit earlier. Sundowners, which are unique really to our community here in Santa Barbara County, are starting now. In fact, we had a recent 150-acre brush fire just up in Hollister Ranch, and some of you actually even received some evacuation warnings from that. It's important to stay informed about emergencies that impact you. Sign up for the alerts at readysbc.org. And remember, if we can't reach you, we can't alert you. If you previously registered for Wear and Prepare alerts, just a simple reminder to go back and make sure that your information is updated and that we have the correct contact information for you, including phone numbers. Now is the time to update your emergency plan and your kit. Talk to your family and friends about evacuation and sheltering during the pandemic. Consider what supplies you may need to add to your Go kit, such as face coverings and hand sanitizers that might not have been on last year's list. More information on how to prepare for the kits are available, again, on the websites. I've always advocated to not wait around for somebody to tell you to leave if you feel like you should leave. The public shouldn't wait for an announcement. If you feel like you're in danger or you're not comfortable where you are, don't wait for the evacuation order, but leave. If I could just finish by letting you know that we are all in this together. We continue to work cooperatively and collaboratively with all of our partners, operational area partners here in the county, law and fire, cities, the county departments, and the districts, and we will get through this all together. Thank you, Chair Hart.
Thank you, Chief Hartwig, and thank you to all of the men and women of the county fire department and all the local fire departments in our county for doing everything that you do every day to keep us safe. I also invited Maricela Morales, Executive Director of CAUSE, to join us today to talk about the work that she and a consortium of community organizations are doing to support undocumented families in need during the COVID-19 crisis. The 805 UndocuFund is a collective effort among Ventura and Santa Barbara County-based grassroots organizations to assist local undocumented immigrant families and individuals who are excluded from federal safety net programs. Thousands of our neighbors who work in local restaurants, pick and process the food we eat, work in child care centers, and contribute to our local economy have been economically impacted by the loss of jobs due to the coronavirus. Thank you, Ms. Morales, for being here today to tell this important story.
Thank you. Thank you so much, Supervisor Hart, for the invitation. The 805 UndocuFund is a collaborative of Future Leaders of America, Mixteco Indigenous Community Organizing Project, and CAUSE. And it was birthed out of the tragedy of the Thomas Fire and the Montecito mudslides. And over the last 2 years, because of the subsequent yearly fires, has maintained active and served over 1,800 families. That's more than 10,000 people through those families that were served through the UndocuFund. And to give everyone a sense of the enormous need now, given COVID, we had to close the registration line at 7,200. So we have 7,200 people, undocumented workers, who are waiting to get some humanitarian relief aid. It's not an income replacement. As Supervisor Hart said, undocumented workers do not receive any of the federal stimulus, not a dime. Their wife or husband, even if they're a citizen or legal permanent resident, is effectively punished and does not receive the federal stimulus. Their citizen children do not receive the federal stimulus. So with 40,000 in Santa Barbara County alone, 40,000 undocumented people are people who serve us. They might be our friends, they might be our family members. They are effectively, literally out in the cold, completely shut out from any economic safety net. And they are at the same time, the lowest paid workers. Across the nation, people earning less than $40,000 have been hit the hardest. 40% of workers that earn under $40,000 have lost their job or lost hours, compared to 20% of people who earn over $40,000, so twice the hit. So they're the lowest income earners. They do jobs that we need them to do when we're active and running, and they are shut out. And so the UndocuFund is a charitable effort. We've raised so far, it's been really, really inspiring, $2.4 million in just the last 2 months to provide relief aid. Everybody who qualifies, to the extent that we have dollars available, will receive a one-time relief aid of $1,200. And we set that amount of $1,200 to also convey that they matter. They are people too. So even though they're not receiving the federal stimulus check, they matter getting that $1,200. So we ask people to, even during these times, to be generous. If you're one of the lucky ones that makes over $40,000, that hasn't lost their job, that's receiving a federal stimulus, to connect to your heart, to your spirit, and to consider making a contribution to the 805 UndocuFund. We have had people give their federal stimulus check as a contribution to the 805 UndocuFund. And so we welcome whatever amount. No amount is too small. No amount is too great. One of those donors was a magnificent major donor at $1 million. So about half of what we received came from a very generous donor. But regardless, no amount is too small, no amount is too great. We project needing to serve those 7,200 people about $8 million. So it adds up, and your generous support at any level will go a long way in helping our friends and neighbors and our workers who have been left out in the cold, unfortunately.
Thank you, Ms. Morales. I know many hardworking local families are facing very tough times now, and I'm so grateful that CAUSE is working hard to identify generous local donors who can help these families with the help that they need. If you want to help this important cause, please go to 805undocufund.org, 805undocufund.org. Thank you again for being here. Now we'll go to questions from the room. Ms. Lair?
I'd like to start with you, Chair. You mentioned, could you reiterate how much money the county could get from the state fund and what it will do to prevent layoffs?
The county is really hopeful that this funding will continue through the state's budget process. The governor has identified $1.3 billion in the state budget from the federal CARES dollars that are going to be allocated to cities and counties, and our proportional share of those dollars by formula is approximately $45 million. We're facing a larger deficit than that. There's about $10 to $12 million in direct costs that we have spent to date in responding to COVID-19, and the difference is the lost revenue that our county expects over the next 2 budget cycles. So this will not fill that entire hole, but it could go a long way toward making that deficit up. And we're just really grateful to all the people that weighed in on this issue with the governor to protect the vital public safety and community services that we depend on here in our community and are funded by these dollars.
Maybe you can contribute to the UndocuFund. Okay, my next question is, Dr. Ansor, John Palmentary mentioned if someone got a contact trace call, do they stay inside for 14 days, or what is the protocol for that person who might have been in contact with someone who is spurred the contact call?
That depends on the situation. It depends, for instance, if this person who was in contact with COVID case is a healthcare worker or in some essential industry, they may be allowed to actually go to work wearing face coverings and with daily monitoring for symptoms. Because if there's no replacement for them, they are very essential in those industries, including healthcare. For other people who are not in an essential business, they are asked to self-isolate for the incubation period of this virus, and that is 14 days, yes.
Thank you.
Next, we'll go to questions on the phone.
Yes. First up, Josh Molina with Newshawk.
Yes, my question is for Dr. Ansorg. We only have 3 reported cases today. What is the county public health department on testing? Do you encourage, because testing is available now, everybody to get tested regardless of whether they have symptoms? Is that helpful? What is sort of the direction from the county on people? Should they get tested at all, even if they don't have symptoms right now?
Yes, we do encourage people to get tested. It will help us to get a much better idea of how many people were in contact with the virus. So I think we should all take advantage of the opportunity. Of course, people who are worried about having been in contact with it or have symptoms should have priority, but it is open to everybody regardless of their symptoms, yes.
And do you know if you're tested once and you're negative, if you get tested again, if insurance companies will pay for that second test?
That's a very good question. I actually don't know the answer. I know for an initial test, it is covered. I would think that if you are symptomatic and a doctor orders the test, it will be different. So it may vary from case to case.
Okay, thank you.
Thanks,
Ne-
Mr. Molina.
Next up, we have Annika with KCOY KUIT.
Hello, I have 2 questions here. I was just at a press conference in Santa Maria with local leaders talking about the importance of wearing masks. Can you describe to me the county's efforts or thoughts on that campaign and whether the county is going to be pushing mask wearing by all individuals or not?
Yeah, I'm happy to speak to that. These face coverings are really meant to inhibit the spread of, in this case, mild respiratory secretions to others. So in an indoor environment where there's not wonderful ventilation and where maybe there are more people inside than you would hope for, a face covering will prevent the spread of the virus, definitely. It will not necessarily be a complete prevention for me catching it, but it will be a very close to 90% prevention for me spreading it. And that is very important, especially in indoors situations and venues like grocery stores or pharmacies, or when waiting in a line and you possibly cannot maintain social distancing. So therefore, these face coverings play an important part. I always caution people that don't get into a false sense of security when you wear this thing, because hand washing and keeping a distance 6 feet apart from other people has so far been more reliable from spreading the virus than just wearing the mask. In conjunction, it adds up, and therefore we do encourage it. We haven't gone as far as some cities have in mandating it for indoor settings, but we are actively considering that. Now, if you're outdoors all by yourself, there's nobody around you, there's really no point in wearing this mask because you're not spreading the virus to anybody. Having said that, if there's nobody around you. So I hope that answers your question a little bit.
That does, and that leads nicely into my next question about mandating mask wearing. Is the county, you said they are considering mask wearing being mandated. How would they enforce that? And how serious of a discussion is that at this point?
It's a very serious discussion that we're having on a daily basis. There are pros and cons to face covering. The research is not very clear. There are studies that state that it is very helpful, and there are other studies that state it is not that helpful. Our point of view is also, well, at least it doesn't do a lot of harm, except for some people who have breathing problems, lung disease, or children, they should not wear masks. So they would definitely get exemptions. With regard to enforcing things, I leave that up to our Board of Supervisors and the law enforcement units. We give recommendations or sometimes mandates, but the Public Health Department is not in the enforcement business.
Thank you, Annika. That concludes our phone questions.
Thank you, everyone. I want to take a minute to remind everyone about the symptoms that we should all pay attention to that could indicate that you have COVID-19. The early symptoms are very common to a wide range of colds and flu that we would normally ignore. To stop the spread of the virus, we need to be more cautious if we are experiencing any of these symptoms. This recommendation is especially important now that we're beginning this new phase of managing the virus with more businesses reopening. If you have any of these symptoms or a combination of them, please don't go out. Isolate yourself at home and wait a few days to see if the symptoms go away quickly. If they do, you're probably safe to go about your daily life. The symptoms to pay special attention to are cough, shortness of breath, fever, chills, muscle pain, sore throat, or a new loss of taste or smell. The precautions businesses are taking to protect their customers and employees are very important to protecting public health and will help keep us safe. However, we must all remember that each of us is the first line of defense against the virus. We cannot let our guard down. We must remain vigilant to the daily habits that together have bent the infection curve and will now allow us to box in the virus. Please remember to practice these 3 simple steps every day. Stay home as much as possible. Remember to wear a face covering and stay at least 6 feet away from other people. Number 2, wash your hands very often and for at least 20 seconds. Don't touch your face and regularly disinfect surfaces. Number 3, if you feel sick, if you feel any of the COVID-19 symptoms at all, don't go out, isolate yourself at home, and if your symptoms worsen, call your doctor or clinic and follow their medical advice. Our next press conference will be Friday at 4:30 p.m. If you have any questions, please call the county's call center line at 833-688-5551. And again, if you would like to be tested for COVID-19, please call 888-634-1123. Please be safe, and thank you very much for joining us today.